Imagine a world where a doctor receives an alert on their phone. Patient X has a 92% risk of a heart attack in the next 6 months. I recommend starting preventive treatment. This isn't a dream, it's the present of medicine, thanks to artificial intelligence. Today, we'll explore how algorithms and robots are redefining diagnostics, treatments, and surgeries, saving lives that were once considered lost. Are you ready to discover how AI is creating faster, more precise, and more human medicine? Join me on this journey into the future of healthcare. In 2023, an 8-year-old boy in Japan was diagnosed with a rare genetic disease after 15 doctors failed to identify it. The hero? An AI algorithm called AI Hospi by M3, which analyzed his DNA and symptoms in 7 minutes. This is just one example of how AI is surpassing humans in diagnostic precision. Cancer. The Lunit Insight MMG system detects breast cancer in mammograms with 99% accuracy, according to a study in The Lancet. Compared to the 85% accuracy of radiologists, this avoids thousands of false positives annually. Neurology. At Massachusetts General Hospital, the AI Cure.ai analyzes brain scans to identify strokes in 2 minutes, versus 30 minutes for a neurologist, crucial for saving lives. Ophthalmology. The iArt algorithm by iNook scans retinas to detect diabetic retinopathy in 60 seconds, already used in clinics in India, where there's one ophthalmologist for every 100,000 patients. But it's not perfect. In 2022, an error in the Watson for Oncology system recommended an unsafe treatment for lung cancer, reminding us that AI is an assistant, not a god. In 2024, the FDA approved the first drug designed entirely by AI, INS-018-055, created by In Silico Medicine to treat pulmonary fibrosis. The process took 18 months, versus the traditional 12 years, thanks to algorithms that simulated 40,000 chemical compounds. But this is just the tip of the iceberg. Oncology. The Tempus platform analyzes the genetic profile of tumors to predict which chemotherapy will work. In a trial with 2,000 patients, it reduced prostate cancer progression by 62%. Mental health. The app Wobot uses AI to provide personalized cognitive behavioral therapy. A Stanford University study showed it reduces anxiety by 30% in 2 weeks. Rare diseases. Deep Genomics uses AI to decode genetic mutations. In 2023, it identified the cause of a neuromuscular disease in a Brazilian girl after 10 years of uncertainty. The future is even more astonishing. Projects like Google Project Baseline collect data from 10,000 volunteers, heart rate, sleep, genome, to predict diseases years before they appear. Imagine a world where your smartwatch tells you have an 80% risk of Alzheimer's. Start this preventive protocol today. In 2024, the Verceus robot performed the first autonomous heart surgery at a London hospital. Guided by AI, it repaired a mitral valve with a 2mm incision, leaving an almost invisible scar. But this is just the beginning. Neurosurgery. The ROSA brain system allows surgeons to operate on brain tumors with a 0.1 mm margin of error, using real-time 3D maps. At Cedars-Sinai Hospital in Los Angeles, it reduced surgery time from 8 hours to 3. Minimally invasive surgery. The Senhance robot performs laparoscopies with 4K cameras and haptic sensors that feel tissues. In Japan, it's already used to remove colon tumors in 90-year-old patients with low risks. Emergency care. The Trauma Pod, developed by DARPA, operates on wounded soldiers in war zones without human doctors. In simulations, it closed gunshot wounds in 4 minutes, versus 15 for a surgeon. But there are challenges. In 2023, a malfunction in the Da Vinci robot during a prostatectomy in France damaged the patient's urethra. Who's to blame? The manufacturer, the surgeon, or the programmer? Ethics still lag behind technology. AI isn't the end of human medicine, it's its evolution. We're entering an era where instant diagnostics, personalized treatments, and surgical robots will save millions of lives, but also pose unprecedented dilemmas. Would you let an algorithm decide your treatment? Would you trust a robot to operate on your child? The answer lies in balance. Using AI as an amplifier of human skills, not a replacement. What do you think? Will medicine be better with AI, or will it lose its human touch? Let me know in the comments. If you want to keep exploring the future of technology, subscribe and hit the bell. Until next time, explorers of tomorrow.